Thanks so much for that, Andrew. I am Ginger Heidel with the Coastal Health District, and I am joined tonight by Dr. Debra Smith, who is a dentist with our district's dental health program. Thank you for being with us tonight. And let's talk about how early oral health should begin. I think it's going to be earlier than a lot of people think. When should parents think about starting to get their kid in to see a dentist?
The newest information is that children should visit a dentist as soon as the first tooth erupts, no later than the first birthday.
Wow. So if you've got a child who's 7 months old and that first tooth starts to come in, then the advice is to go ahead and check with your dentist now, right?
Absolutely. Most parents don't realize, too, that as soon as that first tooth erupts, they should begin brushing that tooth. Water is recommended until a child is 1 year old. At the age of 1 year, fluoride toothpaste can be used, but only a dot the size of 1 grain of rice. Parents should also begin flossing teeth as soon as 2 teeth erupt.
Wow. So if you've got 2 teeth next to each other, then
Absolutely.
That's when the flossing starts. Okay. So what are some of the risks of delaying dental care until, kindergarten or something like that?
Anytime you delay dental care, number one, if there is a cavity, it can get larger. This can cause pain for a child, which can affect their growth and development because they cannot eat properly, and it may affect their speech. So everyone from the age of 1 year to 100 years needs to visit their dentist twice a year. This dental decay can be prevented.
Okay, and along those lines of prevention and dental care, so you run a children's dental clinic at the Chatham County Health Department on Eisenhower Drive.
Yes.
What sorts of issues do you see in your clinic on a regular basis?
I see cavities that are caused by high sugar consumption and a child not brushing or flossing every day. I see 1-year-olds with cavities. Anytime a child goes to sleep with a bottle or cup in their mouth, it causes an acidic environment and 100% will decay their teeth. So no cups, no sippy cups, no bottles in the bed. I see sports injuries where children are hit in the mouth, teens are hit in the mouth. Mouth guards should always be worn when children are playing sports. I also see damage from vaping and tobacco use. Vaping is not safe, nor is tobacco. It can damage the mouth and teeth.
A lot of people think about that in regards to lungs, but you've got the whole mouth and teeth and throat, and there are a lot of things that go into play when you're looking at those substances. So thank you for that reminder. And take us back to the basics of brushing and flossing, how often we should be doing that. Both children and we need to be setting a good example as grown-ups as well.
Yes, everyone should brush their teeth twice a day at least with a soft bristle toothbrush and fluoride toothpaste. Everyone should floss every day. I believe parents should help children with brushing and flossing until they're 10 or 11 years old. It's also important to remember to replace your toothbrush every 3 months. If the bristles are worn sooner than that, and if I get a virus or a flu, I always recommend that we change our toothbrush.
Okay, and what role does nutrition play in dental health?
Nutrition is very important. Our mouths have bacteria. Anything that has a lot of sugar, you feed the bacteria, then the bacteria produce acid, and that is what damages tooth enamel. So we always stress low sugar consumption. Water or plain milk to drink. Soda and sports drinks are very acidic and they have a lot of sugar, so I don't recommend them. Juice can also have a lot of sugar. Fruits, vegetables, yogurt, and cheese for snacks. Chewing gum should be sugar-free. I also recommend that you check the pH of bottled water. Some of them are very acidic. And I recommend that you read the label of everything you eat and drink to determine the sugar content.
Okay, lots of great information. Thank you so much, Dr. Smith.